Daring is a part of my everyday life. I like to try new things and I step out of my comfort zone. When I'm off duty and I try to unwind, I listen to rock music and podcasts about history, economy and philosophy. I'm doing everything I can to live a life worth living. Hi, I'm Ariel Tessone, MD, and I head breast reconstruction here at Sheba Medical Center. As part of stepping out of my comfort zone, I tried plastic surgery and loved it. In surgery, we're always looking for ways to reduce OR time. It makes for better surgery and reduces the risk of complications. As an outcome, we recently discovered a way to reduce 25% of our OR time in our most complicated operations. The time is right for the next big leap in the surgical point of view. And today I'll be speaking about how virtual reality technology helps us deliver better and safer procedures to our patients.
Please welcome to the stage Dr. Ariel Tessone.
Agriculture, industry, communications. What do these three have in common? These are the three momentous revolutions that changed the world we live in. But there's another revolution coming, the virtual revolution. Lately, we're hearing a lot about the metaverse, NFTs, and of course, the big star of virtual reality, gaming. This is my daughter, she's here in the audience with us. But virtual reality is more than just an online experience. VR is also changing medicine. We can use VR to plan and train, but most importantly, we can tailor procedures specifically for each patient. For instance, at Sheba, we can use VR to assess defects in the heart and decide if a patient needs surgery or not, or to image the GI tract. And here is VR being used in the pain clinic to manipulate nerves and relieve pain. As you can see, the future of VR in medicine is huge. But let me dive in and show you how we overcome one of the greatest challenges in breast reconstruction for women who have breast cancer using VR. This is a silicone implant. We use it in breast reconstruction to give volume to the reconstructed breast. It's good, it's very good, but there's something even better, the patient's own body. And for the last 2 decades or so, we in Sheba have been able to build a full breast from the patient's abdominal wall, the tummy, and get the most natural results. This is a very technically demanding procedure that relies on our ability to connect tiny blood vessels around 1 to 2 millimeters in size from the abdomen to the chest. Now that's great surgery. But one of the greatest challenges in this procedure is actually finding these tiny vessels. It's literally a needle in a haystack. So let me give you a challenge that demonstrates the experience of finding those tiny blood vessels. This is an aerial photograph of Tel Aviv and Jaffa. Try to find in that picture the most well-known bakery in Tel Aviv, Abulafia Bakery. It's there, I promise. But it's nearly impossible, right? There are a few things, however, working in your favor. You know what a bakery looks like. It will probably have a large oven, maybe a counter, just as we know what the vessels look like. But that's not enough. It's not even helpful, is it? So we try to make it a little bit easier by adding Doppler mapping. Now, Doppler uses ultrasound technology to detect blood vessels, but it doesn't give us the exact location, the size, or the route the vessels travel in. It's a little bit like saying, I can smell fresh bagels in that neighborhood painted in red over there, so Abulafia Bakery must be there. It's better than nothing, but that's that. The next phase was to get a CT or MRI scan that actually shows the vessels. Now that's a substantial leap forward. It's a little bit like giving you the address for the bakery and handing you a street map. But that sounds so obsolete, right? So 90s. Why can't we use maybe a GPS app or something with live traffic? And that's a little bit like using a 3D model. And that was the best we had until recently. But our aim was to develop something way better, something that would fit our modern life. And for that, we partnered with an Israeli high-tech company, recruited a research student, and went to work on setting up a VR system specifically designed for this purpose. It wasn't easy, there were a lot of details, but we got there. Here you can see me preparing for surgery, seeing not just the location of the vessels, but other valuable information as well. I can decide based on the patient-specific model which vessel is the dominant one, see the route that it travels, all the twists and turns, the junctions and the pitfalls. It's like navigating to the bakery after you've been there already and know the way, and that's amazing. And here you can see the same technology in the OR, and you can see a reflection of our student over there. So in just a few short years, we actually went from this aerial photo to this. We are now conducting a study that will demonstrate the power of this technology, but I can already tell you that we're able to cut OR time dramatically with this tool. And this will be useful in other fields as well, such as orthopedic surgery, pain relief, rehabilitation, treatments for anxiety, neurosurgery, and much, much more. But it gets even better. Imagine what if we could do this in real time. See the hidden tiny vessels for each patient during the operation itself. And this is our next goal, augmented reality. Now, obviously, this is a game, but this is not. Here you can see pictures from our pilot study. It's not ready for prime time yet, but it will be. We aim to make one of the most challenging and demanding procedures in all of medicine easier to perform, shorter, and with less complications, so that more patients can receive the best surgery available. Technology is the greatest enabler we've ever known, and this is my dad trying VR for the first time. Thank you very much.